Hi everyone, welcome to another episode of Before and Beyond. My name is Justin and I'm here to talk more about dental implants today. So I'm going with you through a case that I've done a while back already for a presentation that I did for a university. And so I'm just going to run you through what the whole entire process of a dental implant is like. And over at our dental clinic, we usually use a lot of technology to actually incorporate into our dental implant surgeries so that it is as predictable as possible. So I'm going to run through my thought process, the whole entire treatment procedure as well, and just let me know if you need any help with any questions or not. So initially, this patient comes in to our clinic. This was done 2020, I guess, with a really broken down tooth over here. Okay, so this a very broken down tooth over here is over here, right? So you can see that this broken down tooth is over here, and is really the patient does not have any pain, but she can't really function really well. She can't really chew there, and it was a very large filling that dropped off. Okay, and as the large filling was dropping off, it took away some tooth structure as well. So treatment options were given to her. The first one being no treatment, so we don't do anything about it. That's always a treatment option. The second one is to redo the root canal treatment. But because there is not much tooth left, we need to do something called a crown lengthening procedure, which is called CLP. Essentially making the tooth a bit longer so that the crown that will cap the tooth over it has enough tooth structure to grip onto it. Okay. The other option is to extract and do an implant, or the last option would be to remove the tooth, put some bone material, and wait for about 3 to 6 months before we actually put in the implant. So we took an X-ray first in order to get a better understanding of what we want to do and what is the actual situation that we can present to our patient. And so this is a 3D X-ray, and the 3D X-ray actually shows us quite a number of details. It shows us how much bone there is in 3 dimensions. It's a cross section, and it shows us the volume of bone, the quality of bone, and the density of bone as well. Okay, so with that in mind, we decided to even though we could aim for an immediate implantation, at that point of time we decided to actually go with extracting the tooth first using a very atraumatic approach. We put some bone material in. Bone material is like calcium particles that creates a scaffold or induce some bone cells to grow onto them that actually encourage bone growth and maintain the volume of bone over there. And then in 3 months' time, we actually place an implant over there. When the implant is placed, it takes about 3 months for the bone around the implant to actually integrate and hug basically the implant surface so that the implant is able to take load. All right. So once it can take load already, then we'll be able to put in a crown on the top of the implant to be able to let the patient chew. Okay, so that's our plan. So we remove the tooth, and then in 3 months' time, this is how it looks like. So you can see that from here we remove the tooth, and you can see the outline of the bone is more or less the same. Okay, because we preserved the bone using the bone graft material. And from there, what we then did was, when we are ready to do an implant, we took a scan of the patient. And so this is using a 3D scanner. We take a new scan of a new 3D X-ray of the patient as well after 3 months. So you can see that after we remove the tooth on the left hand side, you can see that once we remove the tooth and we put in the bone material in 3 months' time, we have lost a bit of height, but we have maintained the volume, about the same volume of bone. Okay, so we have actually reduced the height. You can see that it went from 17.75 to 17 mm. All right, and then with the scan that we just did, we actually plan, you can see there's like an animated tooth over there. We actually plan for the future tooth already. Okay, so you want to, if you're seeing your dentist, you want to make sure that they actually plan with the tooth in mind already. So it's called a crown down approach. What I mean by a crown down approach is basically when the dentist plans for an implant, he needs to make sure that he thinks about where the tooth is going to be before actually placing the implant. Okay, because there's a lot of errors if you didn't think about where you want to put the tooth at and you put the implant over there, but then you suddenly realize that the implant is in not a good position compared to where the tooth is supposed to be. Okay, and then it runs into a lot of complications already. So you want to plan out the tooth first. From that, this is quite a complex picture, but this is basically looking at a couple of things. On the top left hand side, you can see that there is a superimposition of the orange color band, and that's the intraoral scan. So that's a scan taken with data that we actually use from the mouth itself, and then it's superimposed using the teeth as the permanent structures onto the X-ray system. So we can have the scan of your teeth with the bony features of the teeth. So with the shape of the teeth, we have the bony features of the teeth of your bone, and also then of the imaginary tooth that we are trying to fill up the gap there. And from there, we can then design the implant position. So you can see that on your cross-sectional view over here, we have sort of the implant outline already. So we can then place in the implant reliably. So this is what I'm talking about. You can have the beige color object over here, and this is from the digital scanner that we scan in the mouth. We can superimpose onto the X-ray. The X-ray is this radiographic information, aka DICOM. And then with that, you can then superimpose the tooth, the planned tooth design, which in this case we usually call it the digital wax up. And with all this in mind, we can actually look out for a lot of vital tooth structure, vital anatomy of your skull that is very, very dangerous if we actually enter or damage. So you can see over here, we can identify straight away the inferior alveolar nerve. Okay, the inferior alveolar nerve is a nerve that supplies taste. It supplies innervation to your gums. Okay, and around the area here. Okay, it's sensation, not movement. So if in the off chance someone damages it, you might feel a bit woody sensation around your lips area, but you can still move your lip. Okay, so obviously we don't want to actually damage any of that. All right, we want to make sure we avoid all of that, and this is the best way to avoid it because we identify all the vital structures first before going in. Okay? And how we actually prevent that is by making a guide. So a guide is essentially like this. So this is a little while back, but you can see that a guide is essentially like a mouth guard that rests on top of your teeth, and that's why we did an intraoral scan of your to record the shape of your teeth. The mouth guard is going to go on top. It has a hole over here where the implant is going to go in. That hole, the direction of the hole, the size of the hole dictates where the implant is going to be placed at, how big the implant is going to be, and the position of the implant over there. Okay, so it takes all of that. So all that planning just now, you can see that we did all the planning. Superimpose the X-rays on top of the intraoral scans. We actually identify all the vital anatomy to place in the implant that is where we imagine the implant should be. Right. This is then this position is translated onto a surgical guide, which is this over here. And so on the day of surgery itself, the dentist, the surgeon, puts on the surgical guide on top of your teeth and has a hole over there, which will then allow the surgeon to place the implant in to where they have planned the implant to be at. Okay, so it's very accurate. I'll show you examples later on. So this is a surgical guide, and this is what you'll be looking at. So I'm going to try to reduce as much blood as possible. Essentially, you're placing the equipment through the hole, okay, through the hole of the surgical guide. When you do that, you reduce the errors present if you actually did freehand. Okay, so this is how it looks like. So you can see this is as gory as I can, as little gory as I can be already. So you're gonna put on the surgical guide. Okay, there's a little hole over there. We use instruments, fine instruments, to go inside and create a space over there, and then we can put in the implant over there. So you can see the third picture from the left is where the implant is, and the implant is essentially a hollow structure that has threads inside. Okay, and then straight away we can put in a healing cap on the top. Okay, and that healing cap molds the gums around it. Now you can see that this is called a keyhole approach, where we actually make a small little hole over there on the second picture from the left and place the implant directly in. Now, it's not all the time that we are able to do this. This obviously is a great way of placing an implant, because a lot of our patients are really happy when they do this, because the pain is extremely minimal. It's like having a little ulcer over there. Having said that, in situations where, for instance, the bone quality and the quantity is not good enough, the soft tissue, which is the gums, the quality and the quantity is not good enough, then we might have to cut the gums, okay, open a gum and expose the bone so that we can actually do our implant procedure. So with that aspect, it's very important to talk to the dentist about this, and in his approach to the surgery as well. Okay, but in most cases, what we can do is we can try to minimize the amount of trauma by doing this. Okay, so this is a different case, but you can see that we place the implant through the guide, and the implant is spot on where we want it to be. Okay, very important. Now, 3 months later, this is how it looks like. You can see the implant is healing really well. The implant's inside within the bony housing, and then there's gums around it that's healing very nicely, and the gums are looking pink. And that just now you saw the golden cap over here. When we remove that, this is how it looks like. The gums have healed around it very nicely. Then we take on to the next stage. So this 3 months later, we take on to the next stage. We put in something called a scan body. A scan body, an implant scan body, is an implant scan body is essentially it doesn't hurt. You take out the golden cap. Okay, it could be a golden, it could be a purple color, it could be a pink color, it could be a blue color. You remove the cap. That's called a healing abutment. You expose the implant already. You put on the scan body. Okay, the scan body doesn't hurt. You don't need to have any local anesthetic for it. You put it in, and you verify the position of the scan body in relation to the implant. And then you record using a scanner. This is a scanner. You record the position of the implant through the scan body in relation to your other teeth. Okay, and then from there you can actually decide. Then you can actually go and design the tooth. The software allows us to design the future tooth. We then take it to our machines. We do have a number of machines over here that we can then make our crowns that will be installed onto the implants. Okay, so you might notice straight away this is our implant crown. You can see that we have stain and make sure it looks great, and from there we then install the implant crown onto the implant. So how it's installed is that the crown has a little hole over there. So you can see in the middle of the tooth, it has a hole over there. Now this hole is essentially where you are placing, is essentially where you put in the implant crown onto the tooth, onto the implant. You take the screw that goes through the hole, and you then screw the crown onto the implant. Now, this doesn't hurt as well, okay? This doesn't hurt as well. The gums might feel a bit tight because we might be stretching the gums a bit, but it's essentially done without any anesthetic, okay? So it's quite minimal discomfort. Once we use the screw to tighten the implant crown onto the implant, you can see there's a hole over there. We'll then use some filling material to actually patch up the hole. And this approach is called a screw retain approach. And essentially, this is important for us because if we are able to get a screw retain approach for our implants and our implant crowns, essentially, if one day you say, hey, Justin, I want to replace my crown because maybe I want to, my crown is a bit chipped off or the color is not nice, I just want to replace it. All I need to do, all the dentist needs to do is to actually drill through the implant crown, through the hole, that means to remove the old filling, and we can take a screwdriver and unscrew the implant crown and remove the implant crown and leave the implant intact, okay? And then what we just need to do is just replace the crown and put it back on, and we are done. We don't need to do anything to do with the implant itself, okay? And because of that, there's very minimal pain involved, okay, of replacing it. Now, it is a very different story if our implant was not placed in the correct position. Now, if our implant is not placed in the correct position, because maybe we didn't use a surgical guide, or it was not ideal to begin with, or there's a lack of skill of the dentist, what can happen is that the implant is placed far off from where the tooth is supposed to be, okay? So imagine if I place my implant like right where your roof of mouth is, okay? Then what happens is that you're going to have a very long tooth just to go all the way to that particular missing tooth space, okay? So because of that, what we have to use is we have to use cement to glue onto our implant. When we do that, the cement over there can cause infection, and the cement there can cause things to get stuck there, food getting stuck there. So we want to try to eliminate having cements around our implants. And so therefore, it all begins with having a good ideal position of the implants before you can actually have a screw retain approach to minimize infections. Okay, and that's how we can try to minimize complications with implants. Also, at the same time, we can extend the longevity of the implants, and implants can last for a very long time. The ballpark figure for implant is about 10 to 20 years. We have seen implants last longer than that as well. And obviously, we've seen implants last shorter than that as well. It really has to do with how the implant was placed, where the implant is placed, in what direction the implant is placed, and whether cement was used or not. And so it's a very complex, implantology is a very complex subject, but we can try to limit the amount of complications by just planning better. Okay, all right. I think that's all for our Before and Beyond. Thank you so much for joining us today. And if you have any questions about dental implants, feel free to just ask or comment below. Thank you.